Welcome to Syphilis, Testing, Treatment, and Guidelines Training video for clinical staff. After watching this video, viewers should be more familiar with 1. Updated testing age requirements for those requiring syphilis testing. 2. CDC required testing algorithm. 3. Treatment, follow-up, and classification. 4. Turnaround times. Let's begin with the first learning objective: updated testing age requirements for those requiring syphilis testing. The age group for syphilis testing can be divided into two categories. 1. All applicants aged 18 years to those aged less than 45 years must be tested for evidence of syphilis. 2. Applicants aged less than 18 years or 45 years or greater must be tested if there is reason to suspect infection with syphilis. Now that we've covered the age group, let's move on to our next learning objective: CDC's required testing algorithm. In this segment, we will explore CDC's required testing algorithm for syphilis laboratory testing. Adhering to this standardized approach is vital for accurate diagnosis and appropriate management. The CDC has established a specific testing algorithm that healthcare professionals must follow when conducting syphilis laboratory testing. This algorithm ensures consistency and reliability in the diagnostic process. Let's break it down step by step. 1. A non-troponemal test, such as the Venereal Disease Research Laboratory or Rapid Plasma Reagent Test, should be used initially for screening. Positive or reactive results from the non-treponemal test must have a quantitative titer result reported, which should be documented on the Medical History and Physical Examination Worksheet, DS 3.26, or the 712 Syphilis Test Exam in the eMedical USA system. 2. Positive or reactive results on non-treponemal tests must be confirmed using a treponemal test on the same blood sample, and testing must be performed in this order. The following tests are allowed to be used for treponemal testing: T. pallidum passive particle agglutination assay, Treponema pallidum hemagglutination test, enzyme immunoassays, chemiluminescence immunoassays, fluorescent treponemal antibody absorb tests, immunoblots. Use products of this test that are either approved by the U.S. Food and Drug Administration or recommended by the World Health Organization, or rapid treponemal assays. Use products of this test that are either FDA approved or WHO recommended. 3. Non-troponemal and troponemal laboratory tests must be ordered by the panel physician at the time of the immigration medical examination, and both tests must be performed on the same blood sample. 4. The traditional algorithm is the required approach for syphilis laboratory testing. 5. Tests performed elsewhere or prior to the panel physician's examination of the applicant are not acceptable. In this segment, we will focus on the third learning objective: treatment, follow-up, and classification. Understanding the appropriate treatment approaches and classification system is vital for effectively managing syphilis cases. Several guidelines should be followed. Let's explore each aspect one by one. 1. All applicants diagnosed with syphilis should be advised to be tested for other STIs, including chlamydia, gonorrhea, and HIV. 2. Applicants with a positive or reactive non-treponemal test, i.e., RPR or VDRL, and a negative or non-reactive treponemal-specific test are no class for syphilis. 3. Applicants with a positive or reactive non-treponemal test, i.e., RPR or VDRL, and a positive or reactive treponemal test are Class A for syphilis and will remain Class A until treated. 4. After completing treatment, applicants are classified as Class B. 5. Panel physicians must treat syphilis according to CDC's STI treatment guidelines. 6. Benzathine penicillin G is the preferred treatment regimen for syphilis. Although alternative regimens are known to be effective, applicants should be informed that BPG is the first-line recommendations in US and WHO STI management guidelines. In this segment, we will focus on our final learning objective: turnaround times. These guidelines ensure that results are obtained in a timely manner, allowing for prompt diagnosis and appropriate intervention. There are two categories to consider: non-treponemal and treponemal. Non-treponemal test results should be available within 24 hours. Treponemal test results should be available within 48 hours. In summary, you should now be familiar with the following syphilis: testing, treatment, and guidelines. 1. Updated testing age requirements for those requiring syphilis testing. 2. CDC-required testing algorithm. 3. Treatment, follow-up, and classification. 4. Turnaround times. For more information, visit www.cdc.gov/immigrant-refugee-health.